G'day and welcome back to the channel. So in today's video, I want to show you one really simple but highly effective and fast acting exercise that you can do if you suffer from headaches or pain behind your eyes. Now, if you're like any of the patients that I see clinically, a headache or a pain behind your eye can be something that you feel like you just have to put up with until you can take some pain medication or even just go to sleep and hope that it feels better after that. But this one exercise that we're about to go through is a very simple way to try and get to the root of where that headache or that pain might actually be coming from. You might start to feel like you get some immediate benefits from doing this exercise. And then at the end of the video, I want to go through the most common reason why people tend to get pain behind their eyes in the form of a headache. But we need to go through the exercise first in order to provide you enough context to help you better understand what might be causing that dysfunction that we're hopefully going to try and settle in this video. Better still, if you're someone who doesn't generally get headaches or pain behind your eyes, please try this exercise as a diagnostic tool to see if you're starting to develop some of the underlying dysfunction that may eventually lead you to developing some of this dysfunction. Because if you can resolve this now, then you can basically try and divorce yourself from the potential of developing these symptoms in the future. So all we need to do basically is to grab a ball of some sort. As always, we can use the trusty lacrosse ball, you can use a tennis ball, you can use any object, a spiky ball that you feel comfortable using. What we want to basically look for is we're actually going to go looking for some stiffness and some tightness and potential tenderness right up at the top of your neck at the base of your skull where it curves in underneath. What a lot of people don't realize is a lot of the pain that we feel behind our eyes in the form of a headache is often a referred pain from the back of your neck right at the base of your skull at the top of that neck. So if we're taking painkillers or trying to go to sleep or doing some stretches or some exercises or any other technique in the hope of trying to resolve that eye pain, if we're not looking potentially for where the root cause of that pain may be, then we can never really instantly change that dysfunction or at least get you to the point where this dysfunction doesn't want to keep coming back. So as always, what we want to do is we want to take that ball, we want to start by placing the ball right up into the middle of your neck, right at the top of your neck at the base of your skull, and then just let it roll off to one side, so not all the way around, but maybe on a bit of a 45-degree angle. And then again, we just want to get you to lie down on top of the ball, and you might need to roll your body a fraction sort of off angle just to get a little bit of pressure through that ball. But what we're looking for, as always with this type of exercise, is we're looking for something that feels stiff, tight, and hard. Now, if this is a symptomatic area for you, it may absolutely feel tender at the same time. But what we're looking for is we're looking for a spot in your neck that may link up to the pain that you might be feeling behind your eye. Now, as we always talk about with this exercise on the channel, it may not be the same side that feels really stiff and tight and tender as to the side that might be generating your headaches. But what we want to do is we want to go looking for some spots that feel tight, stiff, and restricted and see if that starts to increase or decrease the symptoms that you might be feeling behind that eye. Because once you get a good sense of how the ball sinks into these areas, you can move the ball across to the exact same spot on the other side and compare. Generally, what we tend to find is one side does feel obviously and more overtly stiff, tight, and restricted. And all we need you to do with the ball is once you've found it, just gently let the ball press in there for as long as it takes for that tissue to relax and to settle down. So if you feel like it is quite tender, if it's anything above a 3 or a 4 out of 10, there's 2 techniques that we can adopt to try and get that soreness and that tenderness to come down a little bit, to encourage this tissue to free up and to mobilize as quickly as it's going to. We can get you to take a deep breath in, and get you to pause at the top for an instant before relaxing and sighing on the way out. Try to prompt our brain and our nervous system to down-regulate, to try and grant us better access to these stiffnesses and tightnesses and allow them to soften faster. We can keep doing this for 5 to 10 breaths until we feel like the tenderness drops down from like a 7 or an 8 or a 9 or a 10 down to what you would consider being a 3 or a 4, or until you feel like the tissue up here starts to soften and give and release. So the second technique that we can adopt here to try and get this tissue to become less tender or less tight and restricted straight away is to tense that tissue up. So all you need to do is that the area that you feel the ball's pressing into, try and tense the muscles in your neck and at the base of your head. Hold that for 5 to 10 seconds. When you stop tensing it, you might find that that muscle will give a little bit. The ball might feel like it sinks in a little bit further. So then we just want to move the ball around once we've done these techniques, especially around more towards almost behind your ear or on that outside part of your neck. We're looking for anything at the base of your skull or onto your neck that feels like it might be tight, stiff, or tender and you might feel is contributing to your headache or your eye pain in a way that you may never have realized before. So once you've potentially found where the heart of your headache or pain behind your eye might actually be coming from, this can give us some really good context to understand why you might develop this dysfunction in the first place. Finding where the potential root cause of that pain can be is obviously very important, because then we can backfill an explanation for why that might be there in the first place. So what I tend to find clinically, if you know exactly whereabouts in your neck the root dysfunction or the cause of that referred pain to behind your eye might be coming from, we can then start to pay attention to some of the positions and the shapes that you put that part of your neck into day to day to hopefully help explain why this might be there in the first place. And again, as I always say in the channel, one of the biggest things that I find clinically is that if you're someone who knows which exact segments of your spine you have developed some stiffness and some tightness in, and if relieving and releasing that stiffness and tightness helps resolve or reduce your symptoms, there has to be a very specific reason for why that exact part of your spine has become stiff, tight, and dysfunctional in the first place. And again, what I find clinically is it often comes back to the shapes and the positions and the postures that we might end up in throughout the course of our day, doing the things that we do the most throughout our day that we need to pay the most attention to. So if you know that the upper left-hand side or right-hand side of your neck is potentially the root cause of that pain behind your eye, then there's a strong likelihood that some of the positions that you might be getting into ask you to look down acutely enough to bring in that part of your neck, and then you might be looking to one side more than the other to bias one side or the other, potentially staying there for long enough that that tissue needs to get stiffer and tighter to adapt and support against that shape. Now, the interesting thing about the top part of your neck is that the obvious one could be that you're looking down through that part of your neck, but the one that gets lost a lot is potentially getting a little bit rounded and then craning your neck to then look forwards again, where you're compressing that part of your neck and creating a lot more load through that area. So what I would urge you to do is, if you can take the time to try and chronicle some of the activities and the shapes and the positions that you might be in the most throughout your day-to-day life, start working back from the ones that you spend the most time doing down to the ones that you don't spend the most time doing, looking for clues and some sustained positions that might generate some of the load through that neck that might build up over time, become a bit overloaded and irritated, and then express itself to behind your eye in the form of a headache or a pain. And only once you can understand those shapes and how you position yourself day to day, can the exercises that you're doing to resolve those symptoms truly give you some long-term sustainable relief over time. So once again, I genuinely hope that was helpful, and I hope that it provides you a little bit more perspective for you to hopefully better understand what's the cause of your underlying eye pain, and then also what you can hopefully do to resolve that pain long term.